All right, so let's go with the parathyroid glands and the parathyroid hormone disorders. You know that parathyroid hormone is a major regulator of calcium and phosphate. That is, this hormone is secreted by the parathyroid glands and is not in the general endocrine map because the regulator of the release of PTH is a decrease in serum calcium concentration. And you have to know that this the reaction of the gland is almost immediate because calcium is a very important electrolyte that has many effects, especially in muscle contraction and also in the internal vesicle transport of cells. So the main function of PTH is to maintain calcium concentration of the extracellular fluids, which is in balance with the intracellular fluid. So how it does that? Basically, you know that the main storage of calcium are the bonds. So this hormone, when released, it promotes the movement of bony calcium into the bloodstream. Also, you know that for the absorption of calcium, the vitamin D is essential. So this hormone increases the activation of vitamin D, and also a way to increase blood calcium is to prevent its elimination or excretion by the kidneys. So the kidneys can retain that calcium in exchange with phosphate that is excreted. All right, this image shows the homeostasis of calcium. You know that when calcium raises a lot, then the thyroid gland can produce calcitonin, and calcitonin will increase the excretion of calcium by the kidneys. Also, it will move the calcium into the bones, so the homeostasis is restored. And the opposite, when calcium levels fall, then is the parathyroid glands that secrete PTH, and through the effects we just saw, the homeostasis is restored again. Okay, so hypoparathyroidism is a deficiency of PTH, and this in turn is going to cause hypocalcemia, and this may be due to a congenital condition that where the gland doesn't develop. It's called the DiGeorge syndrome, but also it can be due to surgery of especially of the thyroid gland. When it's removed, then the parathyroid glands are also removed or damaged during neck surgery. Also, autoimmune disorders that attack the parathyroid glands and destroy them, and also heavy metal damage like lead or mercury. This is called Wilson's disease. If a metastatic tumor reaches this gland, then it may destroy it. Also, an infection, have in mind that this gland is very close to the throat, so infections that spread may affect the gland. And very important, if you remember the videos of that guy, the York cardiologist, he advises all the time to take enough magnesium in the shape of complementary magnesium, right? So magnesium deficiency is a cofactor that regulates PTH release. Okay, so as you know, calcium is very important in muscle contraction, in normal muscle functioning. So one of the manifestations of hypocalcemia is called tetany, which are muscle cramps and spasms and convulsions, especially in carpal tunnel. Also, it will cause paresthesias, which is that tingling in your hands and feet, as well. In the ECG is going to show a prolongation of the QT intervals, and also hypotension will be found. In the central nervous system, it's going to cause lethargy, anxiety, and personality changes, as well as extrapyramidal signs like in the Parkinson's disease. And however, the treatment is not to provide here the hormone, but to provide proper calcium supply. So if you want to diagnose this condition, you will find low serum calcium levels with high serum phosphate levels, and also low serum PTH levels. All right, and then we have hyperparathyroidism, that is caused by hypersecretion of PTH, and this may be primary due to hyperplasia, adenoma, or carcinoma of the gland, or it can be secondary to renal failure, because then the kidney doesn't filter well calcium and phosphate. All right, so this primary hyperparathyroidism is more common after 50 years of age, and it's also more common in women, and it causes hypercalcemia, and this way you will find high calcium in the urine, and you know that connecting this with the kidney disorders, this increases the possibility of kidney stones, which are maybe very painful. Also, you will have chronic bone resorption, and this produces diffuse demineralization of the bones, and this is going to cause pathologic fractures and cystic bone lesions. And well, the signs and symptoms of the disorders are related to skeletal abnormalities, because the calcium, the bones are the main storage of calcium. Also, it will produce kidney pathology, because the kidney is constantly exposed to high levels of calcium, and you will have also elevated serum calcium. So the diagnostic is to determine what are the calcium levels, as well as the parathyroid hormones levels. Okay, so here you have a drawing showing the clinical manifestations of this hyperparathyroidism. Okay, and then we have secondary hyperparathyroidism that involves the hyperplasia of the parathyroid glands, and is going to happen mainly in people with renal failure. So at the beginning of the renal failure, there is an increase in PTH due to decreased serum calcium, and this activates also high levels of vitamin D. Then the disease progresses, the renal disease progresses, and that turns to a decrease in vitamin D and calcium receptors, and that makes the parathyroid glands more resistant to vitamin D and calcium. So that results in elevated phosphate levels induced by the hyperplasia of the parathyroid glands that try to compensate, and this is independent of calcium levels and activated vitamin D. So the end result will be a disease of the bones that is known as renal osteodystrophy. Also, have in mind that the renal failure will continue to progress. So there will be a mixture of symptoms in this case. And the treatment is going to be to try to control that hypercalcemia, giving great quantities of liquid to the patient. At the same time, the patient has to avoid calcium-containing antacids, vitamin D, and antacid diuretics. All right, so because these diuretics, they increase the reabsorption of calcium by the kidneys. Also, biphosphonates, which are very potent inhibitors of bone resorption, may be used in the short term to treat hypercalcemia and hyperparathyroidism. Okay, remember that biphosphonates were also used in the case of very severe osteoporosis. All right, so this is the final presentation and we are done with this.